My name is Alexandra Krause, and I chose to research scarlet fever. So scarlet fever is caused by the pathogen Streptococcus Pyogenes, which is actually the same bacterium that causes strep throat. So there are different types of Streptococcus bacteria. There's alpha, beta, and gamma hemolytic. And the one related to scarlet fever is group A beta hemolytic. So the beta hemolytic species causes a complete rupture of the red blood cells in the affected area. So the beta hemolytic species can be further broken down into 20 different serotype classifications, which relates to the specific carbohydrates that are present in the bacterial cell wall. So the bacteria related to scarlet fever is the group A beta hemolytic. And as you can see in the picture at the bottom right, these Streptococcus pyogenes bacterium grow in chains, and there are these round bacteria that are non-motile, so they don't have cilia or flagella connected to them, and they're extracellular and non-sporing and are gram-positive bacteria. And it's interesting because this was the first unknown that we had to identify for practice with our VUMI, so I just thought that was interesting. So the Streptococcus pyogenes bacteria is spread through respiratory droplets via the nose and throat, so coughing or sneezing, or also contact with the skin of an individual who's infected with these sores or lesions. And obviously it could still be spread through drinking from the same glass as someone who's infected. And the symptoms will appear about 2 to 5 days after exposure, so pretty quickly after being exposed to someone who's infected. So something I thought was really interesting about this bacteria is that it can be spread to cattle and then back to humans through milk, but the cattle can't actually contract the disease themselves, so they won't present any of the symptoms of having scarlet fever, so they won't get like a rash or this strawberry tongue, which I'll talk about a little later, but they're still able to pass the disease on through raw milk, which I thought was fascinating. The systems affected by Streptococcus pyogenes include the integumentary system, which is pretty obvious. This is the skin, and it's impacted by the rash that's forming, which I'll talk about when I get to the symptoms. So the epidermis, which is the outer layer of the skin, gets this really bright red rash, and then it can potentially penetrate to deeper layers of the skin. Obviously, the immune system is affected. So Streptococcus pyogenes really rapidly multiplies and colonizes in the body, and the red blood cells are affected, which I talked about when I mentioned the group A beta hemolytic species, which causes that complete rupture of the red blood cells in the affected area. So the respiratory system is also impacted. Acute diseases may occur in the respiratory tract, as well as the skeletal and muscular system, where joint and bone infections may come about. So symptoms of scarlet fever include this very bright, prominent red rash, which looks really similar to a sunburn. And it begins at the top of the body and spreads down. And something I thought was really fascinating was that when you press down on the skin, it turns really pale, kind of like when you're sunburned and you press down on it and then you take your finger off and it kind of leaves this white spot in your body from where you applied the pressure. It's also the same case with scarlet fever. And then also these deep red lines around folds of the skin, so your neck, your knees, your armpit will kind of get these really dark red lines around them where the folds are. And then kind of the most distinguishable trait about scarlet fever is this strawberry tongue. So as you can see in the image on the right, it actually kind of looks like a strawberry, so this bright red color, and then these white specks that are covering it, like this white coating, and it looks like a strawberry, so it's called strawberry tongue, and that's probably the most distinguishable symptom with scarlet fever. And then other kind of minor symptoms are fever, tender glands, difficulty swallowing, headache, nausea, kind of your standard symptoms when you have a disease. But the rash and the deep red lines around folds of the skin and the strawberry tongue are the most distinguishable symptoms, which can kind of separate it from other diseases. So here I have a video of a guy who experienced the symptoms of scarlet fever, and he kind of gives his testimony about how rapidly the symptoms spread.
hands. I was like, okay, allergic reaction, something with the weather, heat rash. Those dots, though, started to quickly spread. Hands, elbows, I noticed them on my feet. Something clearly was wrong, and I was starting to get really worried because this is not normal. And those dots started expanding, and this is happening like rapidly. Like by the hour, I'm taking photos as you're seeing, and it's getting notably worse. Notably. I look in the mirror, it's all on my back. I'm starting to really, really panic because my face, I can tell, is getting flushed. My lips are starting to swell. It's crawling up my ears, and it's getting ugly. This is like bright red splotchiness just starting to take over my entire being. And I'm freaking. T-virus, Z-virus, L-virus, P-virus, C-virus, E-virus, G-virus. What is going on? I'm looking all over the internet. Not a very good idea. There are a lot of symptoms and there are infinite reasons, and the internet will convince you of all of them. Not a good look for someone who's freaking out. But I didn't know what was going on. I was out of town, and I got to a point where I was like, okay, I have to go to a doctor. I got to get to a ready med. I got to get to an urgent care. Something is up. It is spreading like wildfire. Almost quickly, really. By the time I got to the doctor, guys, it was all over my neck, all over my back, all over my butt, all over the backs of my kneecaps, all over my elbows, all over my forearms. It had spread to this splotchy red.
Okay, I'll stop it there, but I think that's just a really interesting kind of testimony of how quickly his symptoms spread and just how at first he kind of thought it was either an allergic reaction or a sunburn or something, but upon some research and going to the doctor, he discovers he had scarlet fever. In order to determine if a patient has scarlet fever, a strep test is pretty commonly given because both diseases are caused by the same bacteria, which is this Streptococcus Pyogenes. So the main distinguishable thing is kind of the symptoms that are present in the individual. And antibiotics are taken for about 10 days, and an injection of penicillin may be necessary. And then obviously taking Tylenol or drinking more water and resting are all ways to kind of alleviate the symptoms temporarily. I have a chart here of the standard drugs and dosage that are needed when an individual is diagnosed with scarlet fever. So obviously penicillin or amoxicillin are needed in different dosages, but for the same duration of time, so the same 10-day time period. But as I talked about in the slide previously, an intramuscular injection of benzathine penicillin may be necessary, but it's only one dose, so this won't be needed for that whole 10-day period. But it's obviously really important, as we talked about a little bit in class with the antibiotic resistance. It's crucial to take the antibiotic for the full 10-day course rather than stopping early if the symptoms cease to present themselves. So symptoms can clear up really quickly if treated properly. Recovery only takes usually 4 to 5 days. There's no long-term impacts on the body with this disease. And something I thought was really interesting is that the mortality rate used to be 15 to 20%, but now it's actually less than 1%. So it's really important to get antibiotics as soon as these symptoms present themselves in order to ensure that the disease is treated properly. So there's currently no vaccine to prevent scarlet fever. However, it's very easily treated with a course of antibiotics, which will shorten the duration of the symptoms and prevent some of the risks. And some history about the disease is that it was actually responsible for about 36,000 deaths in early 20th century England and was a leading cause of child mortality. But then once the antibiotics were incorporated, the mortality rate dropped about 15%. Finally, some interesting characteristics about scarlet fever. It obviously got its name from the color of the rash that appears on the infected individual's body, so this bright scarlet rash. Anyone can be affected by scarlet fever, but it's really common for kids aged 5 to 15, which, to speculate, I'd say it's just because kids are less careful about, washing their hands and paying attention to kind of where they sneeze and aren't as cautious with that. So it's spread more quickly with children. And then other diseases that are caused by the Streptococcus pyogenes are strep throat and impetigo and streptococcal toxic shock syndrome. And here are my sources. Thank you so much for listening.